All right, so you've decided to enter the world of instrument-assisted soft tissue mobilization. You might know this better as Gua Sha or scraping therapy or Graston technique. Regardless of what you call it, there's a couple universal principles on choosing the right tool for you. And what's neat is this applies whether you're a clinician, meaning someone who's licensed to do manual therapy, or this is for someone who's looking to do more or having more options for self-care. So, do me a favor, stick around, because here we go. Welcome to the Massage Tools Podcast, your home for cool interviews and reviews. In short, the three things to consider are the material that it's made out of, the shape of the tool, and then ergonomics for the user. So, more simply put, how safe is it between clients? What does it feel like to the client? And what does it feel like in your hand? So, here's the list. Stick with me. Starting out with materials, this is the biggest consideration if you're a clinician. Okay, most important part. My recommendation is to head more towards the metal or the plastic option. They're going to be the easiest to keep clean, so you're not transferring pathogens from client to client, patient to patient, athlete to athlete. Okay, so as far as it goes, metal, there's a variety of them. Mostly what you'll find on the market are variants of steel, whether stainless or surgical, but you do find ones like titanium, aluminum, and really the different metal might play more into ergonomics than anything else, but metal, really easy option to clean. Same thing with the plastics. A variety of different chemical names for the types of plastic that are out there, but for using with clients, again, probably the best or second best option as far as hygiene goes. Now, if you're looking more for self-care, or if you've got a client that wants to bring in their own tool and have you use that, then the options are a little bit more open. You do have some of the natural materials, and those are variants of stone like jade and bien, which is the Chinese name for volcanic rock. You can definitely utilize these. Those are probably on the safer side for client to client, although sometimes the bien is porous, and I'm not a microbiologist, but I don't feel comfortable using that between clients. So for self-care, good option. I don't know about in a clinic setting. You do have a couple other natural materials, bamboo and wood. Good options. Be very cautious around the edge of the tool. You do need a little bit more with maintenance or just paying attention and making sure that edge is still safe, hasn't become frayed or splintered or anything like that. And then the last piece that you can find, or last material, is water buffalo horn. This is traditional. I actually learned with this in school, and that's a great starting point. They're great options for self-care. But again, I don't know how hygienic it is between clients, so I would go into those with reservation. So last but not least, worrying about client to client, aim for the metal or the plastic tools that are on the market. The nice thing about it is most of the natural materials have been, or their shapes have been reproduced in plastic or metal, so you can get those super hygienic, but also maybe the desirable shape you're looking for. Okay? So that's the consideration for materials. The second big consideration is the shape of the tool. And to be more specific, we want to look at the bevel and then the overall outline of the tool. So the bevel is the portion of the tool that actually comes in contact with the client's skin. And they come in a lot of different variations. You can have a really acute angle or aggressive bevel. Sometimes they're even listed as single or double. Again, it really just speaks to how quote-unquote sharp the edge of the tool is. And then you have really broad or rounded profiles to the tool. This is going to be style dependent in some cases. So you want to take a good look at the tool. Is it an aggressive, acute edge, or is it a more broad edge? And those aggressive edges or acute edges might be more appropriate for Gua Sha, which is looking to elicit the petechia, those red swaths. But a rounded edge may be more appropriate if you're doing more of a neuromodulation model of instrument work. So understand what your goal is, what the training has in mind for the effect or the intention on the tissues. My personal opinion is err on a less aggressive edge than you think you need. It's always an easy thing to do and create petechia. That doesn't mean you're creating a better treatment, but that is also dependent on or specific to the discipline you're practicing. But like I said, personal recommendation, aim for a less aggressive bevel than you think you need. Moving up to the profile of the tool, or the overall shape of it, like the 10 feet away look to it. Tools come in two broad generalizations. You have the Swiss Army knife, which has lots of different angles on it for getting to different contours of the body. And then you have specialists, tools that are designed really for one or maybe two areas. So similar to the aggressiveness of the bevel or lack of aggressiveness of the bevel, you may want to look at this in regards to what your intention is with the instrument work. So are you a generalist? I run a sport practice with athletes. So it's nice to have a tool that lets me work quads and then go right into hip flexors and then right into narrow tissues like the Achilles without having to put one down, go grab another one, and continue on. So for me, I do err more towards the generalist or the Swiss Army knife shape, but there are times where the handlebar style of thing is really convenient for upper trap or quads / IT area. But again, what's your style? What's your intent? If you're going to be a hand and foot specialist with your job, you probably want a much narrower, more specific style of tool. So might require a little forethought, but think about what you're going to do, what areas of the body. And if you can't think of one specific area you're really going to be working on, go general, get the Swiss Army knife, lots of contours on the tool. So again, this component is really about how that tool is going to interact with the client, patient, athlete. Last but not least are ergonomics. So you got to look at how the tool is going to fit your hand and how the tool fits your work style. If you're one who pushes, then you may want a thicker belly on the blade because it'll let you keep a better grip without having to clench a fist in order to use it. If you're one who pulls more with the tool, you may want to get tools that have more holes in them that provide extra areas for grip or traction. So you don't really have to pinch the blade. You can just have a soft grip on it and use it. If you're someone who feathers, well, you might want to look at maybe a plastic tool that's lighter weight and as opposed to a metal, or a lighter weight metal or hollow metal, various ones that are out there to kind of fit the work style. And then obviously fitting your hand. If you have small hands, some of the tools are just not easy to use for folks out there. If you have extra medium hands like myself, I can use most of the big tools comfortably. And even sometimes with extra medium, I could stand a little bit thicker belly on them, so it's more efficient for my grip and my work style. So those are the two big considerations: fitting your hand, fitting your work style for ergonomics. Remember, the purpose of instrument-assisted work, the main pillar of it, is to actually make things easier for the person using the tool. So that's why ergonomics are super important. But there's two people in a room, unless you're talking self-care, that's a different story. But from a clinician standpoint, there's two people in the room. So make sure it's always a hygienic tool for that person. Make sure that edge is appropriate for working that contour of the body. And then finally, make sure it fits your hand, the clinician's hand, so that you can keep doing what you do. Okay? Better tools make things easier for the clinician, and then the clinician can be in practice longer and help more people. Or if you're doing self-care, find something that's going to be, easy enough to keep clean, but it's your skin, so hey. But that second part with the shape of it, find something that's going to make you want to keep using that tool. If it's super aggressive and you don't like it, it's going to sit on a shelf. So find an edge that lets you work the tissues where it's not a miserable experience, and make sure it fits your hand, because if your hand is sore after you've tried to take care of some problematic tissues, well, now you're going to be less inclined to do your own self-care. So regardless of your place and why you're entering into instrument work, these are important factors for all practitioners. So if you have questions, please put those in the comments section below. If you're curious about reviews on specific tools, hit that subscribe button, because we are going to be releasing review videos in the near future to give you more of an idea on those specifics that we just covered. And then last but not least, hey, if you liked it, please hit the like button. Go ahead and share it, especially if you know some clinicians, some students, anybody else who's looking to get into the instrument field. This hopefully serves as a good primer for them. Alrighty, folks. Once again, thanks for tuning in, and we hope you have a wonderful and safe time out there. Bye. Thank you for joining us, folks. The mission of Massage Tools Podcast is to inspire. So help us inspire you. Ask questions, leave suggestions in the comments section. Give us a like if you enjoyed the video. And if you want to see more content, please click that subscribe button, turn on your notifications, and hey, check out these links for other videos here.